Facebook and YouTube friends. I am Tiffany Hester, the Director of Community Benefits, and I would like to thank you for taking the time to join me here on April 3rd for the Titus Regional Community Update. We have a lot of things to share with you today, but first I would be amiss if I did not thank our wonderful doctors. This past Sunday, March 31st, was Doctors' Day, and we have some wonderful men and women that serve us well at Titus Regional, and we just once again want to thank them for their service and wish them a very happy Doctors' Day. So let's get right into everything that we have to discuss today. The first on the agenda is the Community Needs Health Assessment. This survey is being conducted by Titus, and it is your time to let your voice be heard and for you to tell us what matters about health care for yourself and what you think is important for our community. So if you would take a moment after this update and you could scan one of these QR codes, or we are providing both Spanish and English links in our chat, and you may find these also around town, but we want you to go to these surveys, fill them out. They close on April 8th, so please don't wait. Let your voice be heard and help us continue improving health care for Titus County. The next way that your voice can be heard is through our Coffee Chat program. We offer Coffee Chat the first and third Wednesday of each month at Huey's Coffee right here in Mount Pleasant. It starts at 9 a.m. Members of our patient experience and executive leadership team are on hand at Huey's to answer your questions about healthcare in our community, questions about Titus, and it's just a great way to have a good conversation, find out how healthcare is locally, where it is going, and we would love for you to join us. Our next Coffee Chat is on April 16th, again at 9 a.m. at Huey's Coffee. Another program that we have coming up this month, actually next week on April 9th, is our Lunch and Learn series. This is a monthly Lunch and Learn for our over 55 community. We get together, have a tasty lunch, and get to learn something. And this month, it is being hosted by the Neurology Center at Titus. Both Dr. Khan and Dr. Malik will be on hand to discuss our Gold Plus Premier Stroke Program. They're going to be educating us about stroke prevention, what to do if you may suspect you have symptoms or somebody you love has symptoms, and what to do, and then they will answer your questions. So if you are over 55, this is an important presentation. We'd love for you to join us at the Civic Center. $5 for lunch. It's not all business. We do have some giveaways. We have a lot of fun and a good time at Lunch and Learn, so please join us. The next event I am so excited to share with you. The American Heart Association has honored TRMC for our excellence in our heart, stroke, and diabetes programs. They are going to celebrate with us, and they're on April 22nd at 5:30 in our hospital lobby. They will be talking about these achievements, not only for our team, but the patients and families that we were able to save through these programs. So join us to celebrate these achievements, to hear patient stories as they talk about how these programs have made a difference in their lives. So again, 5:30 on April 27th. We look forward to you joining us there. I'm going to skip a little bit to May and just let you mark your calendars with an upcoming health fair. It's the Cinco de Mayo Health Fair. It is going to be on May 3rd, even though it's Cinco de Mayo. So please look for more information to come on our social media pages or on our website regarding this health fair. If it's springtime, you may be thinking about getting in shape, getting to move, and we would like to invite you to come and tour our wellness center. We have a lot of great classes and options available to you. One is our AquaFit class. That is a class that is a full body workout that helps you with your strength and balance and agility. That class is Monday, Wednesday, Friday at 8 a.m. If you have mobility issues, we also offer a wonderful chair yoga class. These classes are filling up very fast. They're Tuesdays and Thursdays at 11 and 12 a.m. Again, they're a great alternative to exercise that gets you moving, strengthening, stretching, and without having you get on the floor. So if you're interested in any programs or just want to see what our wellness center has to offer, stop by. We're happy to give you a tour. So with spring, we have spring allergies, and if you've been sneezing lately, you are definitely not alone. It has hit my house pretty hard, so I wanted to share a few tips with you about how to help with these spring allergies. And the first thing I'd like to tell you is pollen counts are at the highest in the morning. So when you get up and you know you're going to be outside, check that pollen count. If you can wait a little bit later in the day to get outside, that may help you. If you can't, there are things that you can do. The first thing you can do is wear a hat and sunglasses when you're outside. Keep that pollen off your face and out of your hair. That will help you. If you have to do yard work and are going to be spending an extensive amount of time outside, it's often helpful to wear a mask so you don't ingest that pollen. When you come inside, I know after working in the yard for a while, you're hot and tired and all you want to do is sit down. But if you will get out of those pollen-covered clothes and take a quick shower, get that pollen off your face and out of your hair, it will help you tremendously. Vacuuming your home regularly, wiping surfaces, all are great ways to get that pollen out of your home and help your allergies. If you're still struggling, please reach out to your primary care doctor. He or she can give you the right medication to help with those seasonal allergies. And with spring and all things blooming, so are things biting. I had the opportunity to chat with Dr. David Hester, one of our orthopedic surgeons, yesterday about snake bites. We have seen those in our community already, and so I'd like to take a minute, let you watch this video of Dr. Hester about prevention and what to do if you encounter a venomous snake. Good afternoon. We're joined by Dr. David Hester, one of our orthopedic surgeons here at Titus, to talk to us a little bit about snake bites. Dr. Hester, what kind of snakes do you typically see in our area?
Yeah, in East Texas, you typically see copperheads are very common. Water moccasins, or otherwise known as cottonmouths, are very, very common in this area due to the large water population around this area. And then also you'll see an occasional East Texas rattlesnake.
What should people be on the lookout for around their homes with regard to snakes?
Yeah, typically you'll have old brush piles that have been there for quite a while. Snakes will tend to burrow underneath those and stay, or wood piles that have been there for quite some time. And then occasionally, especially at night, warmer areas, cement pads that may house snakes in that area, anything closed or covered for an extended period of time.
Okay, if you are unfortunate and have been bit by a snake, what should people do, or more importantly, what should they not do?
Yeah, so if you've bit by a snake, regardless of what the snake is, first thing is either call 911 or go to your local nearest emergency room. Secondly is, and the most important things, on site, if a snake has bitten you or you've been bit by, or know someone that's been bitten, number one, do not put a tourniquet on. That's a very common mistruth. The tourniquet can damage the tissue. Number two, do not put ice on it. Again, that's a common misconception. Ice will actually potentially damage the tissue. Number three, don't take any ibuprofen or aspirin. Take Tylenol instead. Ibuprofen and aspirin act as a blood thinner and can actually worsen the symptoms of the snake bite.
What about sucking the venom out?
Yeah, definitely do not suck the venom like you see in the movies. Don't cut the tissue and try to drain it. The main thing is keep the arm or leg immobilized. Just don't move a lot and get to your nearest emergency location.
Okay, how is Titus prepared to take care of snake bites? I know you're familiar with them.
Yeah, so Titus has very well trained emergency room physicians and a protocol that is up and running, and so we have also lots of antivenom. And typically with most snake bites, especially around this area, the treatment is antivenom. Get to the nearest emergency room and start the antivenom process immediately. And most of the times these things resolve hopefully without any type of other intervention. And the reason they're talking to me is orthopedic surgeons are typically the ones that treat these, other than the emergency room physicians, because normally if you're going to get bit, you get bit on the hand or the foot. And so we're the ones that end up taking care of these issues. So,
Dr. Hester, thank you for your time today. I hope we don't need your services, but we're glad you're here if we do.
And I appreciate the time. And also, I would say, in addition to that, when you're out working around lumber, brush piles, anything like that, wear boots, wear gloves if you're digging in the brush and in and around the lumber piles.
Great tips. Thank you.
Thanks.
We want to thank Dr. Hester again this afternoon for those tips. We hope we don't have to use any of them, but if we do, it's always better to be prepared. Now, on to something fun and exciting to talk to you about, and that is the Titus Regional Medical Foundation Grand Gala. We are so excited about this event on June 7th, and everything about this event is going to focus on the little children of our community. We believe at Titus that we want to provide the pediatric unit with a family-centered environment where families can be with their child as they heal, and we are raising money to improve that unit, and your participation in this event is very important. We would love for you to join us on June 7th. Again, we're going to have a fabulous band. We have great auction items, things that you may not have ever seen before at an auction. We would love for you to come join us, celebrate with us. If you would like more information on how you could buy tickets or how your business or family could sponsor a table at this event, please go to our website and get more information there. So that's it for today. I appreciate you joining me for this community update. At Titus Regional, we would love to wish you a very happy Easter. May it be filled with joy, family, and a lot of sunshine today. Have a great day. We'll see you next time.